everyone. This is Dr. Jyoti Rao with Shakti Health and Wellness Center, and this is Facebook Live. And today, very excited to introduce a special guest who's going to talk about a therapy that I find very, very helpful for lots of different things I medicine practice, but just as baseline for stress management. There's a lot of discussion I've had in the past about stress and coping skills, and this is a great tool to add to our toolbox for stress management. And I would like to welcome Anita Sharma. She's a psychologist local to Maryland, but sees patients in 35 different states.
Yes, 35
and she
different
has
states.
Introduced me to a concept called DBT, which is dialectical behavioral therapy. And we're here to talk about the role that it has for anyone, actually, as well as the differences between that and cognitive behavioral therapy, which we know a lot about, which I'm also a little bit confused about the differences. So anyway, I welcome you, Anita.
Thank you.
Thanks for
Happy to
coming.
be here.
And I just want to be able to ask, what is it about this that's different, or as a tool, what is this, and who should be thinking about trying this?
Honestly, anyone that's faced any sort of stressor in their life and has had a hard time moving on from it. And I think most of us can say that. DBT was developed by a psychologist, Marsha Linehan, back in the 70s and 80s, when she saw that her clients that had severe suicidal activity as well as borderline personality disorder were not getting the help that they wanted from CBT, cognitive behavioral therapy. So she thought, I need something more. I need something with more skills. This isn't working. And she started to develop these amazing skill sets in different modules of mindfulness, distress tolerance, interpersonal effectiveness, and emotion regulation. And she came up with very concrete skills that people can access very easily to help become less suicidal, to manage their borderline features. And then as it evolved from there, it started to help in other disorders: depression, anxiety, substance abuse, PTSD, and even eating disorders. There are different protocols that are developed for different disorders. And, I really firmly believe and have seen success with anyone that may not have a full-blown disorder, but is stressed and dealing with a crisis and needs to have a certain set of skills to cope. And I think I went through a DBT skills group myself when I went through a divorce. A colleague recommended it to me. I was having a really hard time coping with all the emotions and going to work and taking care of my boys. And she said, hey, try a DBT skills group. And I said, isn't that for really sick people? And she said, you'd be surprised. So I went through a whole year of a DBT skills group and met some amazing women in my group and learned these skills that I don't think I would have gotten through my divorce without. And now I feel like I've reached the other side. And as soon as I got to the other side, I said, I have to share. So I went through the training, and now I'm running my own groups and my own individual DBT sessions as well. And I'm seeing a lot of success and a lot of interest, and I just want to get the word out.
Yeah, no, thank you for sharing your personal journey.
Absolutely.
There was a lot you said, so I want to kind of pick apart some of this.
Yeah.
So what I heard, so the woman who discovered it,
Marsha Linehan.
I think she also had her own personal journey where she was
did.
looking for treatments because borderline personality disorder actually doesn't have a lot of treatments for it. And then she also used it for herself. Like, I found that it was beneficial for her own diagnosis. Yeah. And then she's a researcher, and then she started doing it and kind of showed the world how amazing it was. What was very, drawing for me about DBT is that its basis and foundation is on mindfulness.
Yes.
Which is, can you describe what dialectical means?
Absolutely. So dialectical means that two opposites can exist at the same time. So that the tenet of DBT is acceptance and change. You want to accept where you are in life. It's okay to be who you are and where you are right now. But you also want to add the idea of change is welcome and change is okay. I am willing to grow. So what we try not to do in DBT is use the word but. We're always using the word and. So I am okay where I am, and there's room for growth. Life is hard and suffering is optional. That's a big one. I can be where I am now and learn to be more effective. So acceptance and change all the time.
Right. And then that is what maybe makes it different from cognitive behavioral therapy.
Yes. So cognitive behavioral is based on the idea that our negative thoughts are distortions. And the way to feel better, to have less depressive symptoms, to have less anxiety symptoms, is to correct these cognitive distortions and make them more positive. Some people really feel like that's an insult. Hey, you're basically telling me my thoughts are bad. And no, it's not that your thoughts are bad. We need to validate where you are. So Marsha Linehan, when she first developed it, it was for borderline personality disorder. Mm-hmm. Borderline personality disorder, for as long as I can remember, has had a huge stigma to it. You know, you're not supposed to treat too many. It takes too much out of you. They're very difficult people to have in your life. Try to avoid them. Well, these are people that have suffered in their lives. Mm-hmm. And it makes sense that they are where they are. And Marsha herself didn't feel like she had validation in her own treatment. Mm-hmm. So the big difference is DBT validates you. It makes sense you have these emotions. Where you are now, you got here for a reason. So there's a lot of compassion and there's a lot of acceptance. There's radical acceptance. We accept everything that has happened, and we're going to work to change it, to make it better, so that you can build. I think Marsha's book about herself was called Building a Life Worth Living. Mm. So you can build a life worth living, and you develop life worth living goals. And it changes your perspective. It's not that the way you think is bad and who you are is wrong and people shouldn't be around you. It's that you got here for a reason, and let's look for ways to make it better.
Right. You're actually changing the way you think. And neural
absolutely.
Rewiring takes time. So
Absolutely.
The way this is set up, and you can go into more details, is that it's a group session, but it's done more as an educational session, like a school, a classroom.
It's a classroom.
A group session, but it's not group therapy.
Not group therapy.
And it can have added on individual therapy, but it's not a mandatory thing.
Not a mandatory thing.
What is mandatory about this program? What is it that is recommended?
I have 2 skills groups. One is virtual and one's individual in person. So if you have a virtual need, you can't come to my office, I'll put you in the virtual group.
In any state or just
in any state that I am approved in, and there's 35 of them. So chances are you'll be in one of those states. And so, you know, I wanted people to have access. So I'm doing the best I can. I don't think it's less effective to be in a virtual group. I think you can access the skills. I myself was in a virtual group and I can't talk enough about it. I just think
And
if
you're someone who says, well, I don't want to share with strangers, it's still okay.
Oh, goodness. So my skills groups are classes. I teach you skills. There is practice. There is homework. The homework, trust me, is not long. It takes you 5, 10 minutes, sometimes 15 minutes. And practice is the key to learning the skills. So that's really all it is. You don't have to share anything too personal if you don't want to. But what I'm seeing in my skills groups is they become close and they start to really support each other and recommend skills to each other. And it's just fascinating how the group takes on a really positive life of its own. I really love it.
And it's usually a 6-month commitment?
Yes. So there's a 6-month commitment for a weekly session that's 90 minutes. And it sounds like a lot, but the minute you start to feel like, this is a place for me. This is a place where I can be myself. This is a place where I'm actually going to learn concrete skills to get through a crisis. I've been doing private practice for over 20 years, right? And I have all these people coming to me like, you've done a great job helping me understand why I am the way I am, but I'm ready to take notes. Tell me what to do. And this group is where you'll learn exactly what to do.
Action-oriented.
Very action-oriented.
Very much about trying to change the way our brain is wired in the sense of, you know, there's a lot of science behind rewiring. And, you know, we used to think that there was no way to change who we are, like our thinking or like skill sets and all that. That's been disproven. We're constantly making new neuronal connections and neural pathways. And so this is kind of another skill group. And I think the way it's been like once a week I love that because you need constant reinforcement.
Absolutely.
And a building system that sounds like has a foundational basis to it, and it's been tried and true, and all of the other things have worked out, and it's been studied very well.
It's evidence-based treatment.
Evidence-based treatment. So in terms of, can you talk a little bit about, we know it works for mood disorders, anxiety and depression, but what about the role in trauma? If you can also expand on what does PTSD and trauma even look like?
Okay. So people with a history of trauma have a hard time regulating their emotions. Often they experience very extreme emotions. Maybe something very small to other people would trigger something. And that's based on past experience and past trauma. They're just more easily activated to emotion regulation, and not their fault. These are really hard things to deal with, even COVID, 9/11. There are so many things that could make us feel that the trauma reacts in the present, so that we react to small things based on these horribly traumatic experiences we've had in the past. So what happens with DBT is that you learn how to regulate these extreme emotions. You learn how to say, okay, yeah, this could trigger me, but what can I do so that I know when an emotion could come and I can calm it down and I can act from a more effective place. So I've seen people with severe traumatic pasts come through a skills group and just feel more in control of their emotions, more confident, the self-esteem goes up, and the neural pathways all along are changing.
Right, because I think everyone wants to have a little bit more control. It's very, very unsettling to be out of control. And we have a lot of things out of our control, the climate, the politics, so many things, maybe even our health, sometimes our new diagnoses and things like that. So these type of tools, from what I understand, can also be very beneficial in kind of looking at what you said logically,
yes,
but also reacting in an emotion way. We're not trying to become robots and have no emotions.
Definitely
we're just trying to
not.
Control,
yes,
and also create an awareness, right, of what
DBT will always validate your emotions and make you more aware of who you are. So the foundation is mindfulness.
Right.
So mindfulness is the first skill set you'll be taught. And from there, the other modules build on from there. So the idea behind mindfulness is that we don't want you living in the past or grasping at the future. A lot of people with anxiety worry about the future and worry about the past, and they can't stay in the present moment. We teach you how to stay in the present and focus on the present and be intentional about the present, so that these feelings from the past and these feelings from the future don't encroach upon you. Mm-hmm. So there's a lot of skills about developing a safe space, breathing exercises. One of my favorite mindfulness skills is wise mind. So a lot of us act from emotion mind, where everything we say and do comes from extreme emotions. And then there's other of us who are more prone to acting from reasonable mind, where you're more cold and just the facts. Well, wise mind wants to bring those two together, so you're coming from a middle path. We combine your emotions and your rational mind and come from a place where you're combining both and you're much more effective. And that's called wise mind. And believe it or not, wise mind is your intuition and your gut. So we teach you to access your own wisdom. Everybody has wisdom. And once you realize, hey, I myself is wise, it opens up a whole new place for you. What people have told you your whole life, like, you can't handle this, you can't do this, you can't. Well, guess what? I'm wise and I can access it anytime I want.
That's wonderful.
Yeah.
Also, I just want to speak to the trauma.
Yes.
It's not all about severe, awful. I mean, that is absolutely PTSD trauma, but there are small T's, mm-hmm. right? And so COVID was a big part of creating trauma. Mm-hmm. Sometimes the elections, I mean, there's
my divorce.
Yeah. There's a lot of life circumstances, but some people mm-hmm. feel emotion such a deep way and it's stored. Mm-hmm. And that limbic system, our amygdala, our hippocampus, mm-hmm. our basal ganglia, like, it is very, very hard to sometimes extract that negativity yes. from it. And that was created for us to be able to survive, right? I mean, historically, when our mm-hmm. ancestors, we needed to have a very hard fear center so that we were looking for the problems. We were yes. looking for threats. We were looking for animals or other mm-hmm. tribes coming in. But it's on high alert all the time, though. So we need to calm it down and say, I'm safe. Yes. And this is not. But I also want to respect the fact that sometimes trauma looks like very many different things for people.
Oh my gosh, it does.
Right? So I feel like that limbic system access we can all benefit from in some way, shape, or form. Mm-hmm. And so in the therapy, do you start with a meditation or a mindfulness
every week
class?
We start with a different meditation or mindfulness exercise. The idea is to introduce people to mindfulness and have them grasp onto any part that they like the best. So they'll learn all different variations. And then we sit back and we say, anybody have feedback? You don't have to. But some people will say, I really didn't like that one. And other people will say, that calmed me down like you wouldn't believe. And then they'll put that in their pocket, that's what I'm going to use when I go home. And the next week, it'll be switched. One person will be like, that was amazing. And another person will be like, that didn't really speak to me. Mm-hmm. And so it kind of, mindfulness is for everyone. And there's no right or wrong way to meditate. I think people are always looking for, am I doing this right? Am I doing it long enough? Oh my gosh, my mind travels this way and that. I can't do it. Well, everybody's mind travels. We're so busy. The idea is to, every time it does, you be nice to yourself. You validate, I've got a lot going on. And you bring your mind back to your breath. Keep bringing your mind back to your breath. And when I do it, sometimes it takes me 20 times to bring myself back to my breath. And that's okay. So there's no wrong way. You can do it for 2 minutes.
Skill sets you're giving, like you're talking about breath work, you're talking about maybe affirmations, you're talking about
exactly
calming down your mind with what other types of things are you doing? Like even the mantra, as you were saying, the chants, that repetitive words.
Yes. You can use repetitive words. There's a lot of self-soothing skills. One of the ones that I love the most is developing pleasant events. So in the book that everybody gets as a guide when you in one of these groups or even into the individual sessions with me, they list about 60, 70, maybe even 100 different pleasant events that you can go through when you're experiencing a really hard time and you need to distract yourself from this negativity. What can I do? People are looking everywhere for it and they can't come up with anything, especially when they're really upset. Well, guess what? There's this list of 1 billion different pleasant events that you can do, right from going for a walk to I'm going to smell my favorite candle. I mean, it can be big or it can be small. It's calling a friend. It's sitting quietly. It's watching your favorite show. A lot of it is distractions. It's okay to look for a distraction. It doesn't mean that you're not validating your emotions, but sometimes the emotions are too heavy and you need some relief. So we teach you ways to distract. So, but first you have to be aware. Sometimes you just don't feel good and you're just irritable. You're like, why am I irritable? And then you have to kind of reflect on that, right? Yes. So you have to become aware. Yes, you become aware. We teach you how to understand your emotions and then become more effective using your understanding. So there's a lot of emotional and mental health benefits, but what about physical health? Is there a role for this in pain? Oh, definitely. I think where pain management, where it really helps is mindfulness, which is the foundation of DBT. So again, there are, working from Wise Mind, when you have an extreme amount of pain, it's very difficult to access your center. And we'll teach you to calm down and access your center, to be kind to yourself, that it's okay that I experience pain, but I need to self-soothe. We'll find ways to self-soothe that bring the pain signals down. We'll find ways to distract so that it's not the biggest thing in your head right now. Mm-hmm. Maybe the DBT group can't cure the pain, but it can help you manage it better.
Mm-hmm. And what about in sleep disorders? Well, I know that one of the biggest tools for insomnia and sleep disorders is CBT, mm-hmm. But what about DBT?
DBT, first of all, validates that you can't sleep because there are a whole host of reasons, mm-hmm. and it's okay. And you'd be surprised how many of us deal with insomnia or deal with wakefulness. And it comes from a place of stress and worry, anxiety, depression. We all come by it honestly. One of the big things you'll learn is sleep hygiene. And I think that's so important, developing your sleep routine where you decide to wind down at a certain point of day and nothing can stop you from doing it. You schedule it like you schedule your doctor's appointment. I am going to, now is my sleep time, and everything goes off and you decide what is the best way for me to relax in that moment. Is it listening to music? Is it taking a long bath? And that triggers the system to start to relax, to say, hey, it's bedtime. We need our triggers for relaxation. If you go straight from work to dinner to a show and then you try to go to bed, who's going to be able to do that? Yeah. We need a period of relaxation before we drift off into sleep, especially those who have difficulty hitting the pillow.
Right. So it's not a light switch. It's not we have to tell our body that we're in a safe space and it's time to rest, and we shut off the lights and the same stuff. You don't look at your phone. I mean, this is building on all of those things. Yeah. So can you, as a new person, can you take us through what the first couple of sessions will look like? You said we get a book.
Mm-hmm. And so it's the evidence-based manual for skills that Marshall Lanahan developed, and each person, I will give each person the book they're present upon entering the group, and it goes through each of the modules. And I always start with mindfulness. So they walk in, they sit down, and the first session it's very structured, so you feel safe, you feel like it's predictable. You're not going to walk in like a group therapy session and who's going to have an outburst and who's going to do this, and I don't want to be here. It's very structured. So first you come in, everybody sits down, we make sure everybody's there, and then we start a mindfulness exercise. So right away, you come to your center. Then we get feedback about the mindfulness exercise. And then we go right into reviewing homework from the week before.
Which you said wasn't too long.
No, I promise you it's not long because I wouldn't have done it if it was. Yeah. And basically, homework is practice of the skills you learned the week before. And everybody gets a chance to say what they practiced and how it went. And it's okay if it didn't go well. That just means we need more practice. So, and then after that, we learn new skills, and I use all kinds of mediums. I show videos, I do interactive exercises so that you don't get bored and you want to be there. Mm-hmm. And this is all about your self-care. So who can't take an hour and a half a week for self-care?
Mm-hmm. Mm-hmm. But say you have things come up, right? You can miss a couple of sessions.
The policy for DBT is you can miss 4 in a row without being kicked out. Okay. Once you miss 4 in a row, then it's like, okay, this person doesn't want to be here. I'm not going to force you to, but you can miss 3 and come back at the 4th and I'll welcome you. Mm-hmm. Okay. So the idea is not to put pressure on you, but in order to succeed, you need to make the 6-month commitment, because that's how it takes 6 months to get through all the skills.
And then at the end of 6 months, is there like a refresher? Is there a follow-up? Like what happens at the end of 6 months?
Well, the research is showing that staying in the group for 1 year, where you go through the skills twice, makes it, you can access the skills very easily once you're on your own. So they recommend that you stay in the group for a year. I never force anybody to try to do that. 6 months, you're done, that's fine. I myself stayed in over a year, and now I can access skills like this. Mm-hmm. Anytime I need a skill, I will know which one I need. Okay. So some people stay in longer. Other people leave and come back a few years later. We have graduate groups. A lot of people offer graduate groups for people who just need a refresher and just need to come in for a month. Oh, yeah, that's what I use. Oh, yeah, that's the one that I like the best. Yeah. And so that's much less of a commitment.
So at the end of 6 months, you can choose to stay or not, but you're left with some sort of daily practice or homework.
And
right?
that book is yours to keep. And all the skills are in there.
And then, so can you give us a story of something you've seen that has been like something that sticks with you in terms of a journey?
First, I'll tell you my own experience. When I started the group, makes fun of me now because she said, you were the one who came in, a professional who eye rolled at everything, and this is a waste of my time. And now you're DBT's biggest fan. So, you came out the other side and you feel more confident. I do. I feel more confident and I have more self-esteem, and I just wanted to share it with everybody. Yeah. And then what's been so great is watching women come through my groups and feel more confident in knowing themselves and knowing where their emotions come from and not apologizing for them. That's the best thing. I'm not going to apologize for where I came from and what happened to me and why I feel the way I feel, but I've learned to manage it. And people who are having stronger relationships, their self-esteem is better. People are using these skills instead of substances to feel better.
Right, that's another area, substance abuse.
Substance abuse. It's very much evidence-based success with this for substance abuse.
Right, and so the one thing I didn't say before is right now, currently, you're only doing women. It's groups.
Right now. I'm open to another group with interest that could be co-ed or just men. Right now I have 2 groups, one virtual, one in person, both for 17 and older women.
Right. So this is not just for women.
No. It's not just for women. It's just what came through my door right now.
Great. So is there anything else you want to share about DBT? I feel like we went through a lot. I think we answered most of the questions. Yeah. How do people find you and how should they locate you?
My email, sharmapsyd@gmail.com is a great place to find me. My office is in Towson, in the Exchange building. I have, we can give my phone number.
Yeah, we'll put these 2 flyers. We can put these 2 flyers with our...
all my contact information is there, and you can also use your phone to access my website from the flyer.
This was great. Thanks for being here.
Thank you so much for having me.
I really enjoyed this because I feel like the more tools we have to be able to access our emotions, and this is a great combination of kind of combining our logical side and our emotional side, which we both need, both of them. We need to live in both both spheres. And I feel like this kind of a tool is so revolutionary because it does focus on a concept that I love, which is mindfulness. And it can build on that. And it sounds structured. It sounds safe. It sounds like, you know, you don't have to be worried about speaking up about a personal journey that you're not safe with.
No.
But anyway, please look at it. If this speaks to you, I think we'll add all of the information to the group's site, and so that we can have anyone who's interested contact her. Thank you. Thanks for being here.
Thank you so much.